Indications. For the topical treatment of inflamed dermatoses where infection by susceptible organisms and inflammation coexist, e.g. intertrigo and infected eczema. For moist or dry eczema or dermatitis including atopic eczema, primary irritant or contact allergic eczema or seborrheic eczema including that associated with acne. Also for intertriginous eczema including inflammatory intertrigo, perianal and genital dermatitis. Organisms which are susceptible to miconazole or dermatophytes and pathogenic yeasts, e.g. Candida spp, also many gram-positive bacteria including many strains of Streptococcus and Staphylococcus. Therapeutic class: hydrocortisone and combined preparations. Pharmacology: miconazole nitrate is an imidazole antifungal agent and possesses antibacterial activity. At low concentrations, it interacts with fungal cytochrome P450 which results in inhibition of a demethylation step in the biosynthesis of ergosterol. At high concentrations, miconazole interacts with membrane lipids causing direct membrane damage which results in leakage of fungus cell constituents. It appears that fungostatic effects result from the inhibition of membrane sterol synthesis in membrane. Hydrocortisone is a corticosteroid used for its anti-inflammatory and immunosuppressive effects. Its anti-inflammatory action is due to the suppression of migration of polymorphonuclear leukocytes and reversal of increased capillary permeability. It may also be used as replacement therapy in adrenocortical insufficiency. Dosage and administration: it should be applied topically to the affected area 2 or 3 times daily. The same dosage applies to both adults and children. In infants, long-term continuous topical corticosteroid therapy should be avoided. Occlusive dressing is usually only necessary in the case of nail lesions. Once the inflammatory symptoms have disappointed, after about 7 days, treatment can be continued where necessary with this cream. Interaction: amphotericin antagonizes effect of miconazole. Contraindications: the drug is contraindicated in individuals with a history of sensitivity reactions to miconazole or any of the components of the preparation, viral disease of the skin, herpes, chickenpox, perioral dermatitis, rosacea, ulcerative conditions, tuberculosis or syphilitic processes. Side effects: generally it is well tolerated. An allergic reaction to any of the ingredient of the cream may occur. Rarely, irritation and burning may occur. Pregnancy and lactation: administration of corticosteroids to pregnant animal at high doses can cause abnormalities of fetal development. Topical steroids should not be extensively used in pregnancy. Precautions: it should be used with caution when applied to extensive surface areas or under occlusive dressings including baby napkins. Application to the face should be avoided.